us today to share a little bit more about the Upward Health transition. Sophie, I'll hand it over to you to share slides.
Great. Hi, everybody. Nice to be introduced to you all. I think I've actually come to this meeting a time or two in the past, but my name is Sophie Boudreau. I am the Manager of Strategic Partnerships for the Health Plan of San Mateo, and I am joined here today by two folks from Upward Health as well, and so I'd love to have them introduce themselves. Asada, feel free to start.
Sure. Thank you, Sophie. My name is Asada Hamill. I'm a registered nurse and functioning as the clinical operations manager of Upward Health for our partner, Health Plan of San Mateo. Thank you for the warm invite. Brenda, I will pass it along to you.
Hi, everyone. My name is Brenda. I'm a community network coordinator, and my main role is to partner patients with services in our communities.
Great. So I'm going to go ahead and share my screen with our presentation. When we do that, we'll probably turn our videos off, but turn them back on for Q&A at the end. And excited to take you through some of these transitions and share this information with you. So just confirmation, folks can see the screen, right?
Yes.
Great. Okay. So we're going to go through a bit of an agenda today, give you some background, talk a bit about Upward Health and the models of care, work through our transition plan, as well as the communications plan, and then our future vision for the Home Advantage program and some additional information. And we can also provide these slides afterwards if folks are interested. Okay, so a little bit of the background. As you might already be aware, HPSM has been offering a program providing at-home care and case management to high complexity, high acuity members who have dual eligibility in Medicare and Medi-Cal. And this program has long been called Home Advantage. Home Advantage used to represent a specific level of this program, the longitudinal care program, where these members are provided this enhanced case management and at-home support, usually for a pretty lengthy period of time. There were other kind of programs that were launched during this time, and one of these additional levels became Alert Care, which became an annual healthy check program with at-home urgent care visits and annual checks. And so the previous partner for these services was Landmark Health, and in fact, you might have been thinking that Landmark was the name of the program or something to that effect, but Landmark was really the provider who was providing these services under the program of Home Advantage. And this Home Advantage program has always been, the health plans program. And so we have a new partner for these services, and that partner is Upward Health, who you were just introduced to some key contacts just now. So a little bit about the process on the health plan side. HPSM last year initiated a request for proposal process starting in July. And there were HPSM team members reviewing proposals from 6 organizations. So we really took very seriously the organization's capabilities around delivering high quality care and their understanding of HPSM asks. And through that process, we ultimately made the decision to partner with Upward. They are an organization that demonstrates great flexibility. They're willing to collaborate with us and focus on the member and their experience. They had a very detailed proposal with comprehensive longitudinal focused care and on-demand levels, and we will talk to you more in a few minutes about what each of those levels represent. But the umbrella term for this whole program continues to be Home Advantage. And they're also focused on care delivery as well as quality improvement and data-driven methodologies. All right, Brenda, hand it over to you.
Hi, thank you, Sophie, for introducing our organization. Upward Health core services are based upon multidisciplinary team providing in-home primary care and supported provider services. Services are based on a whole person model of care, addressing medical, behavioral, including addiction and social determinants of health. Technology enables services including advanced analytics, outreach and engagement tools, high-intensity telemedicine, and remote patient monitoring. Local employed care team, including physicians, MPs, RNs, social workers, care specialists, and leadership staff. Lastly, care is delivered in partnership with patients' existing care management teams with a focus on reducing barriers to care for individuals and complex needs. Here are the Home Advantage programs offered to CMC members. Home Advantage Current Longitudinal Care, which offers a whole care including behavioral health, addiction, and comprehensive support for social determinants of health, and multidisciplinary teams acting as a PCP or surrogate PCP, and 24/7 access to clinical services, which the same / next day provider services, visits. Next, we have the Home Advantage Focused Care, new service episodic care, which offers up to 90 days of Home Advantage longitudinal program providing an event, for example, inpatient or emergency department visits, changing diagnosis, and visit with members after discharge within 3 days to review care, treatment plan, and medication with subsequent follow-up visits. Lastly, we have the Home on-demand currently alert care, which offers access to 24/7 clinical support services, first aid, consultation, and triage services, and in-person annual wellness visits. I hand it over to you, Sophie.
Okay, great. So if you're familiar with the Home Advantage program that was delivered under Landmark, you might be curious about what some of the changes are that you can anticipate with Upward Health. And, one element of this is really eligibility. So there was a proprietary kind of algorithm that was previously used when Landmark was the deliverer of this program. But we are in the process of developing new eligibility criteria. It's a partnership between HPSM and Upward Health. We're focused on risk stratification, mobility, and homebound concerns, as well as the capacity for the program to have an impact on outcomes. And something I want to highlight for you all is that the program previously had 2 tiers. It was the Home Advantage Longitudinal and the Alert Care. And now there's this additional tier of care, Focus Care, which Brenda talked about on the previous slide. This is for members that are experiencing a significant change in their health status. It doesn't necessarily mean that they're appropriate for longitudinal care ongoing, but that there's a sudden change, an inpatient visit, ED, change in diagnosis. And so they need really concentrated support for a 90-day transition period. And that's going to be implemented shortly, this new tier of care. It's not quite in effect yet because we're in a transition process from Landmark to Upward, which we'll talk shortly about as well. And the last piece is that, from the Landmark perspective, a lot of this care delivery program was focused on the closing of care gaps. It was a very medicalized model in terms of collaborating with the member PCP and care coordination. And these new services under Upward Health are really whole person centric. The care delivery is focused on social determinants of health, care management, and collaboration with member PCPs. But, the kind of that inclusive model that goes beyond kind of that clinical focus to include elements of social determinants as well as behavioral health, things along those lines. One thing I also just want to say about on the previous slide, sorry to backtrack for a moment, but the CMC members are the members, targeted for this program. And we will talk about referrals. Referrals can still be made for Medi-Cal only members as well. They do have to be HPSM members to be eligible for referral, but we'll talk through what that referral process looks like. I just want you to know that CMC as well as Medi-Cal members can both be referred. Okay, so we are in the midst of a transition plan, as you might imagine. We didn't want to have any sort of interruption in services, so we are transitioning the members that were previously under Landmark's care to Upward's care. And so there's been 3 phases to just try to kind of mitigate having so many patients move over at one time. And these transition dates are stacked starting at the beginning of this year through the beginning of March. So the high transition readiness cohort has already transitioned as of January 1st. And then the next phase of the medium transition readiness, as well as those alert care members, transitioned as of yesterday. Upward has been providing the care to those members. And then the upcoming phase 3 are going to be the folks that are the least ready for transition, kind of have been the most potentially dependent on the Landmark team. So we're taking extra care with this group, transitioning them over as of March. And each of these members that are identified as having specific needs are going to have an IDT between Upward and Landmark. And I did see a question from Dr. Scheinbein about how many total members. There are about 1,200 members in this entire population that are transitioning over, kind of broken out by these different phases. There's a couple hundred in each phase.
So I'll go ahead and provide the communication plan. Members, primary care providers, and community-based organizations, CBOs, receive a general notification of that transition. Members receive a letter notifying them in advance of their transition date, indicating that Upward will be reaching out shortly. PCPs receive a list of their members enrolled in Landmark and when they are transitioning to Upward. CBOs receive a list of their members enrolled in Landmark and when they are transitioning to Upward. Upward is outreaching to PCPs and CBOs directly to develop relationships. Upward Health will be outreaching to you about patients in your facilities. They will support you through discharge. Our Upward Health team is developed of Dr. Anupam, National Medical Director, SVP, Medical Affairs, Asara Hamil, Manager of Clinical Operations, Jody Soshiyama, Family Nurse Practitioner, Alexandria Nikolai, Licensed Clinical Social Worker. The team of care support specialists consists of Nursing, Patient Care Manager, Community Network Coordinator, that's me, Community Health Workers, Peer Support Specialist, and Upward Health has additional providers available to serve the needs of the patients as we continue to grow in San Mateo.
Okay, so as far as next steps are concerned, so we kind of have a multifaceted transition in the works, and we are transitioning about 1,250. So I said about 1,200. I might have underestimated a little bit, Dr. Scheinbein. Landmark Engaged members who are transitioning to Upward Health in these 3 phases. So this transition work actually began all the way back in December when Upward began outreaching to the members, and it's going to continue through the end of this month. And at the end of this month is when that care delivery is going to be finalized for all members. All members that were under Landmark will be under Upward, and so the transition period will end. And just so you know, generally the outreach and the getting of consent from these members takes place in the month prior to transitioning the actual medical care. So Landmark and Upward are both in operation simultaneously until March of this year. They're jointly working to transition these members. The referral process continues to remain open, and we'll talk in a moment about what that looks like. But Upward Health is now the entity that's receiving referrals, and this process is actually in place. And then, another goal is just to familiarize both our internal teams as well as key external partners like yourselves about what Upward Health does, some of their functions through these trainings and materials.
Great. And Sophie, I think we've got a question that just came in the chat from Ionia at Seton about whether Upward Health nurses or RNs will visit their patients in the hospital.
Yes, and I think I will step in and take this one. So our patient care manager, who is a registered nurse and very much so functions as a case manager within a case management role, will visit the patient in the home, and then there is a 48-hour discharge assessment that she will also follow-up assessment once the patient is discharged, that it be to a SNF or a return back home.
Thanks so much, Asada. Appreciate it.
Sure, no problem.
Do we want to, I saw another question pop in the chat. Do we want to take that, or do we want to, because we do have time for questions at the end. We can address them all in one fell swoop, but whatever works best for this process.
Yes, I think the question was along the same lines as the prior. So I can just answer it now. So all of our patients that have transitioned in phase one have been identified as residing in assisted livings and boarding care homes, and they are being seen, actively being seen by our care specialists as well as our patient care managers. So that is being done currently.
Yes, and folks that are, temporarily residing in assisted living, board and care facilities, absolutely Upward will continue to work with those clients. The only folks that would be excluded would be those really in long-term care or hospice. Those are folks that would be excluded from transitioning or from the program. But that's actually that was in place with Landmark as well. So that's not necessarily a change, just a continuation of policy. Okay, so referral process. If you are aware of somebody needing additional support and you'd like to refer to Home Advantage, we have a member referral form. It is on our provider forms website. I did link you to the website itself, and you'll see that Home Advantage member referral form there. And then our medical directors at the health plan will review all referrals to determine medical eligibility. If approved, these members are going to receive welcome packets and outreach from Upward Health to initiate their care. And if denied, then the Health Plan of San Mateo Integrated Care Management Team is going to reach out to that member to assist them with their care needs. And then the referring providers are going to receive an update on the status of the referral in 5 business days from the submission. So just from the health plan's perspective, what is our future vision for this Home Advantage program? Right now, I will share that we are focused in Q1 on the continuity of care and services. We want to minimize disruption through this transition to a new provider. We don't want patients or providers to really experience disruption. But the remainder of this year is really going to be focused on the refinement of the model with Upward Health. We have a lot of thoughts and a lot of great ideas on how we can continue to make this model really work for you, work for our members, and we're very open to hearing from you. We're very interested in developing these relationships and getting your input. So that's definitely on the docket for the upcoming year. Back to you, Brenda.
So, thank you, Sophie. This is our number. Feel free to reach out if you want to write it down.
And we can send out the slides as well. I think that was a question earlier, but if you would like to reference the number through the slides, we will happily send this deck out.
Sophie?
Yep.
Yeah, it's Richard. Because we have a lot of skilled nursing facilities, could Upward Health also expand on what their role or how they might help out with the patients in skilled nursing specifically, rather than the Home Advantage program, but it could be from transitioning the patient out to home, or in that continuity of care oversight that they have as a patient who's in the Home Advantage program goes into the hospital, gets transitioned to a skilled nursing facility, and eventually home. I think that skilled nursing would like to hear a little bit more about that.
Sure. So as the goal and what is being used now or on our end is that, we have an ADT report with a third party provider that provides us real-time ADT information with a large portion of our San Mateo, our hospitals in San Mateo County. So we have access to real-time information regarding admissions, discharge, and transfers within those healthcare settings. So when a patient is admitted for an inpatient stay and or a ER visit, that doesn't necessarily equate to a ER stay. We have that information real time. We have the rapport. Our care specialist team have the rapport with the patient to really reach out and identify what were the events that led to that ER visit, The goal is to provide that particular patient with support and care to avoid the ER visit or the VR ER admission, hospital kind of admission route, but we are aware that sometimes there are cases that the patient will go to the ER, be admitted, and then from that inpatient stay, will be discharged to a SNF. Because we have access to that information, and because our care specialists have the day-to-day contact and rapport with patients, we are a part of that communication. From there, we then communicate to our patient care manager, which also facilitates communications with discharge planners, social workers within the acute setting. And then that transitions to the next level of care, that it be a SNF. If it is a SNF, then our patient care manager also coordinates with your case managers or social workers to formulate a discharge plan, identify services that the member will be receiving from Upward, just to ensure that continuation of care is provided, and then also provides an interface between the Upward team, the SNF, as well as communicating it back to the health plan in an IDT setting.
Thank you.
Sure.
So this is our contact information. And if you have more questions, I'll pass it over to Asara. Please raise your hand or write them down in the chat box so I can read them.
And
Thank you.
one thing as well is that if you would like to be connected, we realize that for some folks, receiving information in this large group setting, you need some digestion time. If there's interest in having kind of further meetings, more focused conversations, feel free to reach out to Stephanie, who I know is kind of a lot of folks' primary contact at the plan, and we can facilitate these one-off meetings with Asada, Brenda, and others from Upward as needed with your facility directly. Other questions that folks have that haven't come up so far, you can also just unmute yourself to ask. That's totally fine. No.
So Sophie?
Oh,
No, go ahead.
so Sophie, this is Stephanie. Thank you for the presentation and really, I know this transition is happening, kind of quickly, and thank you for including our SNFs in this transition. I do want to stress to our SNF providers that if you guys have a lot going on, and I know it because I talk to almost all of you, if you really truly want a one-on-one with maybe your social work staff, more of people that would be involved with Upward Health, please feel free to reach out to me, and I, again, will set up some one-on-ones with your facility that'll be more intimate to what your needs are or what your previous challenges are, and possibly talk to see about how, working to, really enhance the program that we had started with Upward Health. So I just wanted to leave you with that and just kind of throw it in there. Please feel comfortable to let me know, and I'll move forward with it. But thank you, Sophie and Upward Health for the great presentation.
Thanks all. Pleasure presenting to you all, and we will get this deck out to you for your reference. I'm going to do a couple of edits because, of course, when you present, you always notice some things you want to change. But other than that, I'll get it out shortly.
Great. Thanks so much, Sophie, and to the Upward team for joining us today. I know that the folks who are on the line today may not have all had a chance to say hello verbally, but we'll definitely be key partners for you in the San Mateo community. So excited for everyone to connect on this program for really serving our Home Advantage members.
Sure. Thank you so much. Thank you so much for taking the time.
Great.
Thank you, everyone.
Appreciate it. Well, our last item this afternoon that we want to make sure that we cover is just touching base a little bit on some general updates with IOA. And so we're joined by Gail Carino this afternoon to share a little bit more here. We don't have slides for this portion. Really want to have this as kind of more of an open discussion. So Gail, if it's all right with you, I will hand it over to you to say hello to the group. I think you know a lot of the folks here on the line today. But would love to, have a chance for you to share some updates around IOA and ask any questions of the group.
Hi, thanks, Colleen. I hope everyone can hear me. I'm Gail Carino. I am the Integrated Services Manager for our long-term services and supports here at Health Plan. I may have met some of you, and just a little background, I used to be the Regional Director at IOA for the CCSP program, in which Jenna LaPlante is now the Senior Manager for. So just wanted to give that context as I talk through IOA and just a temporary referral process for today. So thank you for having me. This kind of discussion, or this plug into this temporary process, kind of came about in thinking about how we recognize that, with the transition of IOA to being a community supports provider for nursing facility transitions, we don't quite have yet, but though it's coming very soon, a pathway for requesting for IOA community supports, or the support with transitions for your members or our members in your facilities that that you identify meet the IOA or the CCSP then criteria, and that would actually benefit from their support because they are ready to transition to a community setting. So knowing that we don't quite have that pathway laid out, we want to be able to support with meeting the needs of these members and have this temporary pathway in place. With that said, I'm not sure if Jenna's going to be able to join today, but I did hear that a lot of these, the IOA is still receiving some of these referrals through the old pathway of sending it over to their IOA Connect. I would recommend that we stop sending those, because that process isn't really valid anymore at this time, given the transition on January 1st. But instead, what we'll do is with our HPSM inpatient UR nurses supporting this process, the nurses that are assigned to your facilities, they can work with your staff, I think primarily the social workers, to help identify these members that could use IOA support now at this time. And the inpatient nurse will follow up with you all soon in regards to a member information template, or this Excel file that in which you can provide the member information of those folks that could benefit from IOA support now, who you would basically refer, or probably have already thought of referring. And we would allow for about a couple weeks from today, so hopefully by February 18th, to assess, or not assess, but give you that time to really identify who those members are, and work with our inpatient nurse to have that information on this Excel file or template completed, and then that would be reviewed by us, and we would be able to determine eligibility, and IOA is on board with beginning their standard process of reaching out to your facility or the referring party, working with you all in the member and starting their assessment, etc. Once they get that eligibility list. So just wanted to put a plug in about that because we understand, we don't have our process quite laid out yet, but our CalAIM webpage will be updated on February 18th. With our process laid out. But as we recognize that there is a need to have IOA support those members now, we wanted to implement this temporary process. I'm sorry I don't have any slides, and I know that was very quick, but I welcome any questions you may have.
Great. Thanks so much, Gail, for that. And I think that Raquel, you had your hand up. You want to jump in with a question or comment?
Yes, hi Gail. Good afternoon. So, because right now I receive one of our members who's currently in a SNF, and they're looking for boarding care or an assisted living, but they send a referral to IOA, and IOA said that unfortunately they're not doing it. It's HPSM. So I'm just wondering, Gail, right now, if I'll go back to the provider, what will I tell her to do for this referral if they want to send something for placement?
So if this member is being referred from the facility, and this member, it sounds like Raquel, I may have missed it. Well, is the member in the facility? Is that? Yeah, so this member can actually be included if they, it sounds like they would meet the CCSP criteria, the old criteria. We can actually have this member on the list, and we can go through the process that I explained in terms of HPSM confirming eligibility and sending that over to IOA.
Okay, so if I get the patient information, should I email it to you guys or to you, Gail, for that?
Yeah, and as we went through this quite quickly, I'm not sure if Melissa's on this call, but I did check in with Melissa. We actually have a template that's pretty simple that you can use with that we would use with all of the facilities to load that information in.
Will do. Thank you so much, Gail.
Yeah, great question, Raquel.
Thank you.
Any other questions? And I think Jenna LaPlante just joined us.
I did. Hello. I'm not sure exactly where you were, Gail, though, so I didn't get you.
Yeah. Hey, Jenna. So I just kind of, I went pretty quickly on the temp auth process, and I did put I did share that, I would recommend that referrals that were going to IOA Connect, that process is not, not really valid anymore, provided the transition on January 1st, and to use this temp auth process for now to identify those members and use that as the pathway to refer.
Did you mention the folks who are already enrolled as well?
I did not.
Okay. So for those of you who know that you have current residents in your facilities who are engaged with us, they will move forward with us as normal. They won't need to be reauthorized. They'll just be working with us, and we'll work in our regular way to support their transitions. By the way, for those of you who don't know me, I'm Jenna LaPlante. I'm the senior manager at the IOA program.
Thanks, Jenna. Stephanie, I see your hand up.
Yeah, Jen, I just wanted to bring some clarity. Just, with working with our nursing facilities, and there recently has come up, questions about, the intake process. So I kind of wanted just to clarify one piece, just so, everybody understands is, you know, through this transition of having a confirmed, you know, process for the new intake process, is this Excel spreadsheet that's going to be going out to you guys. It is really to capture those patients that you're wanting to refer or think they're appropriate, so we can capture them a different way before this official process gets you know, is official February 18th. So if you guys do have, once you get this Excel form, and it could be given to your social worker, your whoever you know, works on these IOA referrals, because I know a few of you have pending intake referrals, just please fill out that form. And Gail's being really gracious to, you know, give you guys, maybe you can submit it once a week until we have this new intake process. That way we can expedite those referrals and not leave them pending. So I just wanted to, Gail, just wanted to bring clarity for our SNFs that that Excel spreadsheet and who you put on there is going to be very valuable during this transition.
And thanks for bringing that clarity, Stephanie. And I would even say, I think, you know, it's totally fine. You know, we would allow a couple weeks even, like it, I think February 18th is a good cutoff in terms of allowing that time for our facilities or our SNFs to identify those members, you know, versus submitting it each week. I think, I mean, whatever works, but I would say 2/18 would be when we would have all the members identified yeah, I think that could work. Yes.
Okay. And also I just wanted to include, because we have worked, the facilities, IOA, myself have worked really hard to really work with our facilities where they've been really comfortable with IOA, and it's been a great working relationship. So if there's anything that I need to help support that from either our nursing facilities or Gail from, you know, working with you and Melissa on the health plan side, you know, please reach out to me and let me know if you have any questions after this meeting, if you don't have any already. We do want to keep that great partnership and relationship that we've had with IOA, and I have to give a lot of credit to Jenna. She's really, her team has really been a big part of making that partnership happen and very smooth. And we just want to continue that. So if you don't have any questions now, please bring them to our attention later, because I'm sure there'll be more questions around it.
Thank you, Stephanie. I have one more point of clarity that I'm not sure if Gail provided when she was talking about the new process. You will not be referring to IOA anymore. What you'll be referring to is the service Community Supports for Skilled Nursing Transitions. At that point, people who are authorized for that service will be sent over to us from the health plan. And then we would be reaching back out to begin the enrollment process with those individuals. Gail, did you clarify that? I just wanted to make sure.
Yes, and thank you for reemphasizing that.
Okay, and then the one other thing that I was going to mention. Oh, Gail, it has escaped my mind. What was the one other thing I was going to make sure to mention? Oh, okay. It'll come to me. I'll leave space for other people to talk and maybe it'll come to me.
Was it the 25, or I think you mentioned the folks that were already enrolled?
Yes, I did.
Prior to, oh, okay.
Yeah, there was one other piece and I've completely forgotten. Just give me 1 second and let other people talk. It'll come back.
Great. Well, Jenna, while you're thinking of that, oh, sorry, go ahead. Was that a question?
This is Ione representing CoSide. Yes. And I just would like to say thank you to IOA. We've had some very successful partnership this past year. We've gotten a lot of people out into the community and it's been a great thing. So just wanted to say thanks.
Thank you, Ione. It's been wonderful working with your team. They're very responsive and helpful. I think that's why it's worked so well.
Well, that's wonderful to hear, and so glad to have that collaboration continuing to happen under the CalAIM umbrella, which is a very ambitious and exciting set of transformations for Medi-Cal really across California, but really exciting to see some of the, I think much more established partners here in Iowa really making that happen already in the community. So a big thank you to the teams supporting this transition so that it does really move into being more managed for our Medi-Cal population. There was one question from Kirsten. Kirsten, you mentioned just a question around whether the criteria will remain the same. And I think, Kirsten, you know most of the group, but again, Kirsten's joining us from the Ombudsman Office. Jenna or Gail, any answers on this one?
So not exactly the same. DHCS has laid out our criteria and, provided our long-term process will be on our webpage. The specific criteria will be there to view, and we will be able to provide more information in terms of the criteria and the process for requesting services. So it won't exactly apply as it were.
I remembered my other piece that I was going to say.
Sure.
Us at IOA received a list of folks, HPSM members who were authorized for our services in the beginning of January. And some of them are current SNF residents. And we have been reaching out to your social service teams to ask them if those folks are ready to transition and if they would like to enroll in our program. And I just wanted to make sure to get that message that from the administrative level down to your social service teams that these people we understand were not referred by you or your teams, but they've actually just been authorized by the health plan to receive the service. So that's why we're reaching out to see, because I think it's a little confusing for folks. They're like, well, wait, I didn't refer that person. But they didn't need to in that initial batch. These are folks who were just previously authorized. And it's okay if they're not ready to transition and they're going to stay in long-term care or they decline services. We just are reaching out to see.
Great.
I have one other question of clarity, because I'm new to this too. This is Stephanie. Will there be, okay, so after this transition and the intake process goes through HPSM, person gets approved for services, Institute on Aging will then take over, follow up on, their needs as they've done in the past. Will the IOA process, as far as after they've been confirmed as they qualify for the program, and say Jenna gets alerted and her case manager goes out there, does their assessment, is all the process after I'm getting all lost in what I'm saying, but after they've been confirmed that they meet the program, does IOA continue the same process that they've had before this new intake process to carry on with their initial assessment, their on-site visit, all the things that they've been doing in the past? It sounds like the only thing that's changed is the intake. Somebody may meet qualifications for IOA, HPSM reviews it, we determine that they meet criteria, and then the referral goes to IOA. I hope I'm trying to make sense of it. So for our nursing facilities, once it gets to IOA and they meet the program eligibility and they're accepted, does everything stay the same on what IOA would implement after that?
Yeah.
Okay, I'm sorry,
yes,
I was
that's
confusing
correct.
myself, but
yeah,
I just want the facilities to know it's just the intake process, but once they are confirmed that they're eligible, all the planning and coordination when it comes to you and your team, Jenna, will all remain the same for our facilities, right?
we will still be looking at appropriate levels of care and doing referrals to either our CFEs or independent housing based upon their level of care needs. And we will still be doing pre-transition interdisciplinary team meetings with the nursing facility discharge team. The only difference that I would say is that because of the new referral process, the way we're enrolling people is we have an outreach person who's actually going to come be the initial point of contact and come out to the facilities and do the enrollment paperwork. And then the person will actually be assigned to a clinician, a care manager, to follow up with the assessment and the community living plan and the level of care determination. So the members will be meeting two people, just one person who does the initial enrollment, and then they'll be transitioned to an actual care manager who they'll be working with.
Okay, thank you.
And that's a great question, Stephanie. You know, just to piggyback on Jenna and to reemphasize, the main difference is how the service is requested.
Thank you, Gail. Thank you, Jenna.
Great. Well, thanks so much for folks joining the discussion today, and thank you so much, Gail and Jenna, for joining us on this to kind of talk through some of those upcoming changes. Anything just to summarize for the group, you know, Gail or Jenna, in terms of kind of what facilities we'll see from us next? You know, you mentioned the updates on the 18th. I know there's a lot of website resources being developed. Anything we should just call out for the group in terms of next steps?
Yeah, great question. I just wanted to highlight that the next step will likely be the inpatient UR nurse with your facility following up with that Excel file or member information template with a few more details regarding process. So soon to come on that, and thank you in advance, Stephanie, for your support with this, and thank you all, and Jenna, I'm glad you were able to come on today, and that we will move forward with this new process, and more to come with our long-term process as well.
Great. Well, thank you to everyone so much for joining us today. If there are more questions that you have that you know, are burning a hole in your pocket and you want to make sure that you ask of this group, please do funnel those through Stephanie. You can feel free to keep myself copied in on those as well. We'll make sure to get them to the right place. But really appreciate the updates and the discussion today about some of these new programs that are really changing in 2022. Have a wonderful rest of the afternoon, and thanks again for joining us. Take care.
Thank you.